Welcome to UMass. We are very fortunate to have the Worcester Recovery Center and Hospital, one of the most modern state hospitals in the country, right next to our medical school. All of our residents get a chance to spend 3 months on the general and forensic inpatient services there during their PGY2 year. I'm Shel Benjamin, Vice Chair for Education in Psychiatry. Come with me and let's have a look inside this beautiful hospital. You can see there's a really unique architecture here. The whole concept of the hospital was to facilitate rehabilitation by creating the impression of a downtown. So these are patient dormitories on the right. We're inside the building, but you'll notice this looks like we're outside. On the opposite side are all of the stores and facilities that you'd see in downtown. So let me show you what the building looks like. And you'll notice that there's a curved area. This is what we call downtown. And then there are 5 dormitories that come off of it. Each one is 3 floors high, and each one has 3 hallways. On this side are adults. On this side, adolescents. You'll notice that each one's a different color and each one has a different leaf from a tree that grows in Massachusetts. This was a clever attempt to create mnemonics that patients would remember which floor they're from. So in the middle here are areas that both sides, adults and adolescents, can access. So we're going to take a look at that. But first we'll look at some of the facilities we have downtown. So in this part of downtown, there's tables and chairs where people can kind of hang out if they have unscheduled time and they're able to be here. There's a game room on the other side of here. And then in the other direction, there's a snack shop where you can pick up sandwiches and things like that. That's for both patients and staff to access. In this part of downtown, there is a salon for hair and nails. There's a bank and ATM. And over there is a small store. And the idea of all these things is to give patients the ability to try out things that they're going to do post-discharge. Now, I trained in state hospitals in Ohio and in Boston, and I've got to tell you, I have never seen anything like this. But this movement studio is both used for physical therapy. You can see over there, there's stairs there, and but also there's bar, exercise balls, yoga mats. This is a place where patients can go to classes. One of the other amazing features of this new state hospital is this, the exercise room. Gives the feeling of being in a hotel workout room. So normally this is the gym, obviously, that can be accessed from both sides. It's actually set up for half-court basketball. It's also set up for movies. But at the moment, it's set up as our COVID testing room. This is the hospital's non-denominational chapel, and its beautiful stained glass windows have an interesting history. Prior to moving to the new hospital, patients on our adolescent units worked with their art therapist to design the windows as a way of working through their feelings in the transition. Their design was then produced by a local stained glass company. On sunny days, the windows cast rainbows on the chapel walls, a truly unexpected sight in a state hospital. This is Imam Saleh. He's the medical director of Worcester Recovery Center and Hospital. And behind us, there's a painting of Dorothea Dix and a statue of Samuel B. Woodward. And Samuel B. Woodward was a psychiatrist from Connecticut who was enticed to move here in 1833 to become the first superintendent of the old Worcester State Hospital. It was then the Worcester Lunatic Asylum, which was on what is now called Asylum Street in downtown Worcester. He served as head of this hospital until 1846, 2 years before the end of his term, he got together with 12 of his buddies from the other institutions in the United States and formed an organization called the Association of Medical Superintendents of American Institutions for the Insane. And you know that organization today as the American Psychiatric Association. He was the first president. The reason that they wanted him to come here and run this hospital was to help transition mental health care from a more punitive model to a more home-like model that tried to involve patients in normal day-to-day experiences, and the therapy sort of helped them through those experiences, moral treatment. So Worcester State Hospital has an important role in the history of American psychiatry. Now, I want to ask Dr. Saleh, what attracts you to working here?
Thank you, Dr. Benjamin. So I remember doing my fellowship here at University of Massachusetts Medical School and rotating at Worcester Recovery Center and Hospital. And one of the things that I truly was fascinated by, that I could see the patients enjoy the freedoms. They were out and about, has a lot of charges, they were legally involved, but they enjoyed a level of freedom that you wouldn't witness anywhere else. I've worked at 3 other different state systems, Oklahoma, New York, and Massachusetts. And when you talk about recovery, I think Massachusetts and Worcester Recovery Center and Hospital is probably a true paradigm of recovery-oriented treatment. One of the things you would notice that the building is new, but if you look at people in the building, multidisciplinary, you look at psychology, you look at psychiatry, you look at occupational therapy, you look at nutrition, we provide a gamut of care that is comparable to any other place, I would assert, in the United States, or maybe in the entire world. So we're providing care to our patients who are coming from mostly marginalized and minority communities.
Many state hospitals built in the latter part of the 19th century were designed according to a plan proposed by Thomas Kirkbride, a Philadelphia psychiatrist. One of the hallmarks of these Kirkbride hospitals was a clock tower. When the 1877 Kirkbride building was being demolished to prepare for our new hospital, some of our faculty and staff worked with Preservation Worcester to convince the state to invest an extra couple $1 million to pay for a contractor to draw an architectural plan, disassemble the original clock tower, label and stack every block and brick, and then reconstruct the tower from its original materials by the entrance to the new hospital as an historical exhibit. The original clockworks and bell can be seen on the ground level. On either side are large plaques conveying the rich history of the hospital. This plaque illustrates the Kirkbride plan, with separate men's and women's sides that progress from admission at the ends toward the administration building in the center as patients improved. On the far ends are 2 round turrets, added in 1886 as suicide watch pavilions, in which 24 patients on each side could be continuously observed, as in this day room. This was the first use of a so-called panopticon in a state psychiatric hospital. Our residency program had its origins in the year 1895, when the Swiss neuropathologist Adolf Meyer was recruited to Worcester State Hospital. Having insisted on a new library and a pathology lab, he created a training program for 4 interns. The following year, Meyer and his trainees were the first in the United States to employ Emil Kreplin's new diagnosis, dementia praecox, a form of what is now known as schizophrenia. In 1978, the old Worcester State Hospital psychiatry residency came down the hill to merge with the newly created UMass psychiatry program. Worcester's place in the history of American psychiatry was assured in September 1909 when Sigmund Freud delivered his only lectures in the United States at the Clark University convocation ceremonies. In this famous photo, Freud is joined at Clark by many of the prominent psychiatrists and psychologists of his day, including Adolf Meyer and William James. One of the many strengths of the UMass Psychiatry Department is the value it places on public sector psychiatry. With its proud history and unsurpassed rehabilitation resources, the Worcester Recovery Center and Hospital is an excellent place to work and train. We hope you'll be able to see it for yourself, soon, in person.